Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Another interesting day, and today we're going to talk about a very interesting topic where people have lots of myths and lots of questions. It's about your first ultrasound in pregnancy. So, when it comes to antenatal care, pregnancy care, ultrasounds are very, very important, and they give a lot of information, and they are both the pregnant women friendly and also the doctor friendly, because in terms of doing the procedure they are very easy, they are not painful, they're absolutely not very invasive, and they're available very easily for people in and around the city. And in terms of access also, you have a lot of access for ultrasound. And in terms for the doctor to know any problem in pregnancy which we actually can't see with our hands on a day-to-day basis, on a regular basis, ultrasounds give us a very good insight into what is happening inside the uterus and what is happening to the pregnancy that is growing inside the mother. And now a word about the ultrasound. People in the olden days, when first X-ray was invented, the elders, or maybe about 20 years back, if you have anybody in the house who are more than say 40-50 years of age, they would definitely tell you that X-rays are not good for pregnancy and X-rays are really harmful for pregnancy. I also say the same word, that X-rays are not good in pregnancy, and you have to do anything and everything to prevent in having an X-ray during pregnancy. And if you have to really have an X-ray during pregnancy, you have to put an abdominal shield which covers the abdomen of the woman, and then you have to go for an X-ray whenever there is an actual need of an X-ray. But ultrasounds, as the name suggests, is not an X-ray. You know what actually happens in ultrasound is, whichever probe or the system that you're using, that emits sound waves, sound waves similar to what we talk, what we hear. These are the sound waves that the machine emits. The sound waves go to the baby, get reversed from the baby and the baby structures or the uterus or the structures around the uterus, and these sound waves which come back from the tissues or the pregnancy or the uterus or the baby, these are caught and made into a picture in the machine. So this is all about sound waves, and ultrasound is one of the safest methods of doing an examination in pregnancy. And you should not have any second doubt about the safety of ultrasound. So this is a clear-cut message that ultrasound is only sound waves that the machine emits, and they go and bring back the sound waves which the machine interprets. And ultrasound is absolutely safe in pregnancy. Now, when we talk about the first ultrasound in pregnancy, it's one of the most beautiful, most anticipated moment for the pregnant couple, because it gives the first impression and first picture of the baby. And when to do the ultrasound for the first time in pregnancy is how your previous medical history is. For anybody first time pregnant, low risk, no risk factors, and that's their first pregnancy, planned pregnancy, everything going good, your first ultrasound is somewhere between 6 to 8 weeks. Why 6 weeks? And after 6 weeks is 6 weeks is the time usually the heartbeat of the baby develops, and we would really like to look into the heartbeat, the number of heartbeats during this early pregnancy scan. And whenever we do the early pregnancy scan in a low risk situation, we know where the pregnancy is located, how many babies are inside the uterus, whether it is one baby, whether it is twins, whether it is triplets, and are the babies divided or are the babies in the same sac. So that can also be known in the early pregnancy scan. And in the early pregnancy scan, we also know about the size of the baby and also the heartbeat. And this size of the baby is actually used to calculate the delivery date also, especially for people who have irregular periods. Definitely for them, this is a very good marker to give your delivery date. In the first scan, you can just have an idea about these things. But eventually, what we are doing nowadays is the delivery date comes with the dating correction in the NT scan, which is the 3rd month ending scan. So, in the first ultrasound, we know where the pregnancy is, how many pregnancies are there, and the size of the baby, the heartbeat of the baby, and whether the pregnancy is correctly placed or not. Is the uterus having any other problems like fibroids, that which you need to map in the early pregnancy scan quickly, because the size of the fibroids actually that the woman has inside the uterus, or any other problems associated with the uterus or ovaries, you can identify in the first scan. And especially sometimes we even look at the ovaries, where we can see the egg that has given to this pregnancy in the form of a corpus luteum with good blood supply. And sometimes we even see the egg that has released for this pregnancy forms into a small cyst-like thing called a corpus luteal cyst. So we can warn the pregnant woman about being watchful, and sometimes if the cyst is bigger in size, it can twist and cause pain. So we can explain them that it's nothing to worry, it's a part and parcel of pregnancy, and just need to be watchful and report to the hospital if you have any acute pain episodes. And this is all about the first ultrasound we actually do for every pregnant woman somewhere between 6 to 8 weeks, and after 6 weeks the heartbeat comes in. Now comes the role of high risk pregnancy woman, wherein with a previous ectopic pregnancy, or a previous miscarriage, or previous history of multiple pregnancies, and previous history of or the current history of an interventional pregnancy, like maybe an IVF pregnancy or an IUI pregnancy, or women who are constantly complaining of pain after missing their period towards one side. It's all about diagnosing if there is a problem. So in such situations, we even do an early ultrasound, say about 4.5 to 5 weeks of pregnancy, because once the beta HCG, the blood level of the hormone of pregnancy is more than about 2,500 to 3,000, we actually look for the location of pregnancy, and it is best visualized after the 5th week. And you can see the pregnancy inside the uterus. So this is a very important documentation for people who have had previous ectopic pregnancies, and people who are going through IVF and all that, to look into the location of pregnancy, and the number of pregnancies also can easily be located at this point of time. For somebody who has had 2 or 3 embryos transferred, you can actually locate the number of pregnancies as early as 5 weeks. So in special situations, and especially for me these days, the ectopic pregnancy rates are much higher than what it used to be before, because of infections or interventions, and maybe fertility treatments and all these things. So it is very important. And sometimes women also complain about one-sided pain that they really have, whether it is the corpus luteal cyst causing pain, or whether it is the general cramps of pregnancy, or it is an ectopic pregnancy. We really need to look into these aspects as early as 5 weeks also, because pain is some warning that we actually can't neglect, because if it is ectopic pregnancy, usually it gives an unyielding nagging pain in one side of the abdomen. So these are some of the reasons why we do a very early scan also. And for somebody who is staying outstation, who's come for a pregnancy checkup at about 5th week, we do all the tests, the blood work and everything, and also we check whether the pregnancy is inside the uterus or not, and then they send them back, to call them back whenever the actual requirement is. And we are all fortunate to have antenatal care with that ease. There are several countries where the antenatal care and ultrasound examination is very difficult, and even in countries like UK and USA, ultrasounds are not that easily available for everybody, and it takes a lot of effort to get an ultrasound appointment. Unlike India, where we have a lot of ultrasound centers and you can have your ultrasound wherever you want, but you should have a prescription of a clinical practitioner and a gynecologist, or a practitioner with a certified registration to get an ultrasound down, because of the PCP&DT rules. And there is another tip that we really want to tell you all is, whenever you're pregnant and you're going for your first ultrasound, you need to carry your ID proof or a document that will show your identity and your address and your phone number, because that is mandatory according to the Government of India currently, as a part and parcel of the PCP&DT Act, which governs all ultrasound centers. And there are several people who just come randomly for an ultrasound without the ID proof, and they'll not be able to get their report or the procedure done because of the ID proof problem. And it's so beautiful to see the first ultrasound, and we allow the partner to get into the scan room if they request to see the ultrasound. And we do give little bit of pictures of the first ultrasound, so that they save in their scrapbook, they save their memories physically in the form of a book or a memoir kind of a thing. And to look into the first pregnancy, the sac, the baby, and a small yolk sac, and the heartbeat of the baby, to look into the way the flicker is seen. Usually I don't suggest hearing the heartbeat at this point of time. I at least wait for about 12 weeks to make them listen to the heartbeat through an ultrasound machine. Now they can see a flicker of the heartbeat that they can actually look at in the screen. And this is so exciting for them, and every pregnant couple just wait for this moment. And to preserve this moment, we have the ultrasound pictures and the ultrasound report that we give. And how much information does this ultrasound give, and how much pleasure the ultrasound gives for the pregnant couple is almost equal. The first ultrasound is absolutely important medically, and absolutely happy giving situation for the pregnant couple also. At times, when there are small bleeding episodes, or there are small collections in and around the pregnancy sac, you need to identify them and be watchful about having an episode of bleeding, just in case if you figure out one. And there's an enormous amount of information that we actually look into when we do the first ultrasound. Maybe previous history of miscarriages. Also, there are several other things that we look into the first ultrasound. But first ultrasound is very, very important. Fortunate people get it done as early as 6 to 8 weeks, and people who do not have access to ultrasound, at least Government of India recommends 3 ultrasounds in your pregnancy, at least. For the poorest of poor people also, in the government setup, they at least try to figure out and give 3 ultrasounds. The first trimester one, the second trimester the TIFA scan, and the third trimester growth scan, so that most of the pregnancy problems can be identified in these scans. And the WHO says at least one ultrasound in pregnancy can really look into the aspect of any genetic abnormalities, which is done at about 19 to 20 weeks of pregnancy. And this is all about ultrasound and pregnancy and how a beautiful experience can be created with an ultrasound that is done. Ultrasounds are safe, and anything and everything that you really want to look as into an aspect of a normal pregnancy, it's ultrasound. As into an aspect of monitoring the pregnancy growth, it's ultrasound. Monitoring the aspect of any genetic abnormalities, it is the first trimester NT scan, 12 to 13 weeks, and the second trimester TIFA scan between 19 to 20 weeks, and the third trimester growth scan between 28 to 34 weeks. So these are something that are good milestones for ultrasound, and we would be talking about all these things in the next sessions coming. And ultrasound is safe, there's no doubt about it. And ultrasound examinations are done by two methods. One is the transabdominal method. There's a probe that does ultrasound from above your abdomen near the pelvic area, just above your pubic bone, and for the early pregnancy, and an internal scan with about 2 centimeters thickness of the probe and a length of about 10 to 14 centimeters probe that gives a closer look into the picture, very closer to the uterus. And transvaginal scans give much more information than transabdominal scans, because transabdominal scans have to go through the entire abdominal wall, the pelvic structures and all that. The penetration is not very good. A transvaginal scan gives you an absolute insight into the correct place and the correct information about the early pregnancy scan. And transvaginal scans are not painful. People just fear about them. They have their own apprehensions, but it is only apprehensions. They're absolutely not painful, and they're very safe. And transvaginal scans give better information all throughout early pregnancy, not only about early pregnancy changes, they also give about information about the pelvic structures, like the cervix, any fibroids, any ovarian cysts or tumors, or any infection or any collections, or very good to diagnose ectopic pregnancies. At times there is a pregnancy inside the uterus and outside the uterus also. We really need to look into every pregnancy for such things. You just can't miss a heterotropic pregnancy. That's called a heterotropic pregnancy, wherein there is one pregnancy inside the uterus and one pregnancy outside the uterus. Usually it happens when you have multiple pregnancies and the location is at different places. And we have seen a lot of cases like that, and they've had all good outcomes because we could identify it as early as possible. And it's just a medical miracle that we've got ultrasound machines that really improve pregnancy outcomes, and they are so friendly to the pregnant woman, to the pregnant couple, and also to the doctor. So this is all about first ultrasound in pregnancy, and we're going to continue the series of antenatal care in the entire month of November, and see you all yet another session tomorrow morning 7:30. Bye and thank you for watching.